thank you everyone for joining us this morning. This is an opportunity for us to demonstrate to you a virtual tour of our Connectathon testing environment. What I'm going to do now is I'm going to turn it over to our one of our domain managers, Steve Moore, give him an opportunity to talk a little bit specifically about what he does here as a domain manager. All right, Steve, it's all you.
Thanks, Phil. So as a domain manager, my job is to read the integration profiles that are defined in my domains, patient care coordination and the quality research and public health domains, translate those into test cases, and then monitor those tests during the Connectathons themselves. I also spent some time writing tools to help facilitate this. And what I want to do is I want to just walk through an example of one of our profiles and the kind of testing that we do at a very high level. So the profile that is showing on your screen is based on the Patient Care Coordination 360X profile, which is a simple one where an initiator sends a request for a referral. Oh, and I've got a bug in my diagram, sorry. And then on the right side where it says initiator, this should be recipient. The recipient can either accept or decline the request. And if it accepts it, it will later send an outcome. And there are variants of this, but this is the simplest workflow. So in our testing, we walk through the use cases, the accept use case, the decline use case, and we ask them, the participants, to collect message logs that we can scrutinize for conformance to the profile's requirements. So the testing for this particular profile, it's use case driven. As I said, there's an accept use case and a decline use case, and then some others that we won't go through. This particular profile recognizes the use of a HISP in the US, which is based on the direct trust standards, if you are familiar with those. And so the HISP actually is a man in the middle between the initiator and recipient. We do not explicitly test the HISPs. We're just kind of testing the end-to-end communication. We have tools that validate the message details. We used to do that by hand, and that's excruciating. And so we're in the process of developing software to simplify that. And then we have a human who observes in real time what's actually going on. And so it's, to me, it's more important to see the end-to-end interaction between the systems to show that two EHRs can communicate, check the screens and make sure things are happening, and not just kind of dry lab messaging going back and forth. And so seeing the participants with their screens, request appointments, accept them, schedule things is important to us. And so the real time used to be done, by walking over on the physical floor and looking at people's screens. And as Phil described, now that we have Slack, we ask the participants to share their screens, and it's actually much more efficient to do this because you can look at the screen for the initiator, switch over to the recipient, and then go back and forth. And so the human does this in real time. The second slide I will show you is, again, a simple one. This is an example of a report that is generated by this particular tool that does scrutiny. And I realize this is an eye chart, you can't read it. The important points are the various columns show what's being tested in detail level, and this is important for the software engineers who want to read the report. The comments on the right hopefully give them enough context to know why it is I'm testing this, and so I want to refer back to the original specification and not just say this test is here because it's here. And then the rows are color coded, and I chose a report that was all green because this particular message that we validated, everything matched conformance based on the tool. Other lines could be yellow for there was a warning, and we have red lines in case there are errors to draw people's attention to it. So again, some of the profiles we do scrutiny by hand to make sure the messages are conformant. We are certainly much better served if we have tools to do this, and in many of our domains, we have very efficient tools for doing just this kind of work. And so, Phil, that's what I wanted to cover, and I will turn it back over to you.
Thank you very much, Steve. I do appreciate it. Now I'd like to turn it over to our other domain manager, Lynn Hoffer.
Hi, my name is Lynn Hoffer. My responsibilities parallel Steve's, but in a different area. So I am responsible for the IT infrastructure and radiology domains. And in my little portion here, there's just 2 points I want to make, both of which sort of elaborate on some context that's Phil provided in the beginning but from the point of view of my domain. When back in October, when it became apparent that the pandemic would mean that we could not gather together, as a domain manager, because I have lots of tests that I have designed with the assumption that we would be making face-to-face, my original thought was, I'm going to have to modify my test definitions and change the way I test a system because we're doing it virtually. And I was surprised to discover that I didn't have to change my tests. So the point I'm trying to make is the rigor that with which we are testing our systems this week is the same as if we had been together in a city in a large room that Phil described. I have not adjusted my test definitions, the methods, the expectations, what the monitors look for, the tools we use are the same. What we've had to adjust is, in some cases, the way we examine the results and the way we interact together. And that actually surprised me, but I'm really pleased to be able to tell the world or a customer who said, oh, this company tested at a virtual Connectathon. It probably was a poor cousin of our face-to-face Connectathon. And I'm confident in saying that's not the case. And it was a surprise to me, but I'm truly pleased to be able to say that. And in a second sort of related point, for many years, because most of the people around this table have been around for many years, we heard requests like, why do we have to come to XYZ city for a week? Why do I have to stand, mostly from the managers, right? Why does my staff have to be face-to-face? You know, this is all networking. Why can't we just do this on the internet? Well, here we are. We had to do it on the internet. And yes, the rigor is there, but the feedback we get, especially from the vendors, the participants, the engineers, I should say, the engineers who are in the room, the monitors who are in the room, and this isn't going to surprise you, we can't replicate as much as we have all this. We can't replicate the standing next to each other, having lunch together, the interaction. And people who've experienced both say that the benefit of that face-to-face Connectathon from the person who's attending and their enrichment and how they interact and make connections that they can contact outside, all that stuff is really difficult. And so I'm expecting that when we have the ability to go to face-to-face, yes, we can do things over the internet, but now whether the managers want to pay to spend, let their people travel anymore, that's a separate thing, but there are things that we can't replicate. And the second point I wanted to make has to do with my specific domain and an observation that I've made. So, and this is true for all Connectathons. So in my IT infrastructure domain, we test the fundamentals of healthcare exchange. So things like security, patient identity management, document sharing that enables things like in Steve's area, patient care coordination, specific stuff. So 7-8 years ago, when we were first doing SOAP-based document exchange, that technology was new, our profiles were new, people came to Connectathons, and in the first few years, we found problems in the implementations, we found problems in the software libraries that prohibited interaction or interoperability, we found problems in the specifications, and now 6, 7, 8 years later, cross-domain document sharing using SOAP, it just works. People come, I've still got dozens of exchanges. They're still testing it because they have new software implications, new whatever. But the Connectathon has manifested its benefit by over 4 or 5 years. The specification is solid, the implementations are solid, and we see it deployed around the world. Now, in the second generation, we have REST-based interactions, fire exchange, not all fire, but a lot of fire RESTful interactions. What I have seen this week is we found some problems in the specification where IHE, like we were either unclear or inaccurate. We've gone back to some fire specs and said, is this right? And vendors who had made assumptions in their implementation based on, how we did it in SOAP, it doesn't work in the RESTful world. So they're debugging their things, and it's really fun for me. And it's fun for me to observe this, but I think it's beneficial to the vendors and the standards community to have this forum to be able to mature the implementations and the standards over time. And that's very rewarding for me. And I really think it's a benefit that the IHE Connectathon brings to the healthcare interoperability community. I think I could keep going, but I'm going to pause there.
Thank you so much, Lynn. Paul, let's let you wrap it up here.
Okay. Well, I would say good morning, but I'm not sure where everybody is. So hello, everybody. My name's Paul Sherman. I am the technical program manager for the devices domain. Used to be patient care devices domain, but we've expanded. In general, it is a medical device that is connected to a person and delivers information to someplace else. So that includes all the standard hospital equipment, monitoring systems, infusion pumps, things like that. And now also more public use devices, which is what we call personal connected health devices. They're pretty new, so their participation in the Connectathon is increasing. So mostly right now it is the mostly hospital-based equipment. I'll start off with what really got me hooked with Connectathon and kind of builds on what Lynn said about the face-to-face part. My first Connectathon was just as a monitor who basically reviews tests that partners have put together and determines whether they accomplish the goals or not. And one of the things that really struck me about the face-to-face was the cooperation. I'm a clinical engineer. I worked in hospitals for many, many years, and I was so used to seeing vendors diss each other, for lack of a better phrase, put down each other in competition, to show up at the Connectathon and find them helping each other out. I mean, it's happening again this year where we've got new participants who aren't sure what they need to do to get the test to succeed. And it's not as easy this year, but we're all working together to try and help each other succeed, which is a level of camaraderie that I've just never seen anyplace else. So our monitors our members are primarily medical equipment manufacturers with some end users and other professionals. And we all get together each year to review and put together new tests for the Connectathon. And it's usually the medical equipment on one end and often a hospital information system on the other end, but it can also be the other. So, some of the things we've been doing are standard, how to set up a patient-controlled anesthesia system, on a pump, how to set the pump up so the patient can give themselves their own medication. The other areas where we're really just getting started in are like location systems. So your RTLS system, getting that to interface with the hospital information system and with the inventory system. So for those of you who are trying to find that infusion pump out there, we can tell you where it is and whether it's in use or not. And that's actually been implemented out in the field. So for testing, we have a group of monitors, some of which are HL7 experts and some of which are not. And they, we have a set of goals that we hope each person can achieve. And luckily, we also work really closely with NIST, the National Institutes of Standards and Technology. And they have helped us put together tools to simplify the testing. So, I'm not a software person. So me going through an HL7 message field by field is really an exercise in futility. Luckily, that's something that a computer can do really well. So NIST has given us tools to catch the really major issues, which is really useful. So for us this year, there was a few challenges with it being remote, but we were able to overcome them. And I think Slack helped a lot with that. We have a few tests where we need to see what's going on live. One is where we're sending multiple messages to between multiple senders and multiple receivers. And that results in, like a dozen HL7 messages or more. And trying to review each of those to make sure they went to where they were supposed to doesn't work. It's far easier just to get up, go over to, wherever the senders and receivers are and look at their screens. And with Slack, we were able to do that this year. We get a Slack message going and we get on video and people are sharing their screens and we're able to see it happening, which it's not, still not as much fun as doing it live, but it's not bad. I think somebody had always enjoyed me running around from table to table looking at messages. The other one that concerned us was we actually have a message system to send waveforms live to the hospital information system. And so, I have to admit, it's a very cool factor to be able to go to like Epic, look at their screen and see a waveform from a monitor showing up in the patient record. And then Slack helped with that too, because they could just share their screen and I could look at one, see the message going out, and look and see the actual waveform showing up. So it wasn't, I still enjoy getting together with everybody, and having that big group in a single room is just great. But this worked out pretty well. I'm pretty satisfied with it. So I think with most everything else I would say would be a repeat of what Steve and Lynn already said. So I think with that, I'll just kick it back to Phil or Amit.
Hey, thanks, Paul. I appreciate you saying that. And echoing what Lynn had mentioned as well, while we said at the very beginning, this, we can definitely replicate the technical nature of what the testing event is. We certainly can't replicate the collaboration that happens just intrinsically, naturally, when people are standing around talking to each other. She mentioned the lunch session. I remember when I first came to my first testing event, and I'm the youngest here that's been to them, I think, and that was about 2009 or so. I remember thinking the meals they served at our Connectathon testing event were so incredible. I was expecting like pizza and like hamburgers and like they had these like full plated fancy meals, and then everyone sits down together and enjoys lunch, and that is the collaboration. I mean, people sitting there talking, going over whatever they had just done, talking about what they could be doing, how to improve the profiles, new things to test, or why don't they do this at Connectathon? And I think that's where we are even today with our standards acceleration programs. And I'm going to give it over to Amit here in just a moment. I don't think he knew he was going to be on, but I'll let him talk a little bit towards that. But I think that's where we came from, just being, the funnel has definitely gotten bigger and bigger and bigger as we go through our testing event, and we're open to more and more and more opportunities. And that happens, those opportunities happen because of the collaboration that does occur in person, of course. So with that being said, let me hand it over to our director, Amit here. Let him talk a little bit towards those items.
Well, Thank you all. And you had me at the food. And so, that was one of the things I know that improved consistently year after year after year. And so I'm looking forward to getting back in person and breaking bread with my colleagues once again, because really that comes back down to the spirit of cooperation and collaboration. This year we've been reflecting a lot as the event has changed. And, I was thinking back to my first Connectathon too, back in 2010. And so like many of you, I was struck by the cooperation and the collaboration in the room, seeing Microsoft and Sun sit across from each other at the same table, seeing so many what we would think of as competitors sitting together at lunch, hashing out issues. That's really the spirit of the Connectathon, a place where you shouldn't be afraid to fail, and you know that you have the collective support of your other technologists in the room. But one thing's for sure, the industry is changing, and I think our event is changing with it. Interoperability is increasingly more about transactions. It's more than transactions, it's more than testing. It's not just sending and receiving information, but making it impactful and improving health outcomes. So today's health information technologists need to consider a variety of complex factors that need to be analyzed. And we're touching on some of those topics on the test floor and in our other expanded conference events. We talked this week, we had different sessions around patient-generated information, correcting patient records, personal health, local health, global health. So all in all, I'm very proud to be part of this large global international community and having the opportunity to work with folks like Phil, Paul, Lynn, Steve. It's really been an honor, and it's been a great week. And once again, thank you everyone who's taken the time to participate, whether it was in the testing floor, help design the testing process, contribute in our conference sessions, and of course, our fantastic team that put this event together, where we've gone from a one-day conference to 5 days of all kinds of programming that we'll make available to the community. And so once again, it's really an honor to have the opportunity to work with such amazing people and carry out IHE USA's mission to improve the quality, value, and safety of healthcare by enabling rapid, scalable, and secure access to health information at the point of care. Thank you, everyone.